Imagine this. You're sitting at home, scrolling your phone, maybe sipping tea, and suddenly there's a strange pressure in your chest. Not sharp, not dramatic, just uncomfortable. You ignore it. Maybe it's gas, maybe it's stress. But what if I told you that in the next few minutes, your life could depend on whether you recognize that feeling or not? Every year, millions of people experience heart attacks, and a shocking number of them don't realize what's happening until it's too late. This just a medical issue, it's a recognition problem. And in today's talk, you're going to learn how to read your body like a warning system, because the difference between life and death can come down to a few critical minutes. Stay with me, because what you're about to learn could save your life or someone you love. 1. The silent killer. Why heart attacks are often missed. Heart attacks don't always look like what we see in movies. No dramatic chest clutching or instant collapse. In reality, many people experience subtle symptoms that feel harmless. That's why heart disease is often called a silent killer. People dismiss early signs, delay action, and lose precious time. 2. Early warning signs. Your body is whispering. Your body almost always gives signals before a major event. These include mild chest discomfort or pressure, unusual fatigue, shortness of breath, nausea or dizziness. These symptoms can appear hours or even days before a heart attack. The problem? They're easy to ignore. Classic versus atypical symptoms. Most people know the classic signs: heavy chest pain radiating to the left arm, but many don't know about atypical symptoms, especially in women and younger individuals. And ultimately, jaw or neck pain, back pain, indigestion-like discomfort, extreme tiredness. Without reason, this is where many cases are missed because the symptoms don't look serious. Attack. One of these vessels gets blocked, usually by a clot. Blood flow stops. Heart muscle starts to die within minutes. Think of it like a 3D animation. A pipe gets clogged, right arrow blood flow slows, right arrow pressure builds, right arrow tissue begins to fail. Time is muscle. The longer the delay, the more permanent the damage. The golden minutes. What to do immediately if you suspect a heart attack. Don't wait. Call emergency services immediately. Sit down and stay calm. Chew an aspirin if not allergic, as it helps thin the blood. Every second matters. Acting fast can drastically increase survival chances and reduce long-term damage. 6. Prevention. Your daily armor. The best defense is prevention. Eat a heart-healthy diet, stay physically active, manage stress, avoid smoking, monitor blood pressure and cholesterol. These small daily choices build a powerful shield against heart disease. Without hesitation, the signs may be subtle. The moment may feel uncertain, but your response must be decisive, because in the end, it's not just about knowledge, it's about timing, and timing can save a life. Heart attacks are often called a silent killer, not because they make no noise, but because the signals they send are so easily misunderstood, ignored, or misinterpreted. Most people grow up believing a heart attack is a dramatic, unmistakable event, someone clutching their collapsing instantly, gasping for breath. But real life rarely follows that script. And ultimately, in reality, many heart attacks begin quietly, with sensations that feel almost too minor to take seriously. A slight tightness in the chest, a feeling of pressure rather than pain, a wave of fatigue that doesn't quite make sense, or even a mild discomfort that comes and goes. These are the kinds of symptoms people brush off as indigestion, stress, or just a bad day. Dangerous, they disguise themselves as something harmless. One of the biggest reasons heart attacks are missed is because people hesitate to believe something serious could be happening to them. There's a psychological barrier where the mind tries to rationalize the symptoms instead of confronting them. Someone might think, I'm too young, or I'm generally healthy, or this will pass. That delay in recognition can cost valuable time. The heart muscle begins to suffer damage within minutes. When blood flow is blocked and the longer it goes untreated, the greater the damage becomes. Yet many people wait, sometimes hours, hoping the discomfort will go away on its own. Another factor is how differently heart attack symptoms can appear from person to person. Not everyone experiences intense chest pain. Some feel only pressure or fullness. Others might notice shortness of breath without any chest discomfort at all. Of unease that's hard to explain because these symptoms don't match the classic image of a heart attack. They are often overlooked. This is especially true for women who are more likely to experience subtle or atypical symptoms, making recognition even more difficult. Cultural habits and lifestyle also play a role in why heart attacks are missed. Many people are used to pushing through discomfort, ignoring their body's signals in order to continue working or fulfilling responsibilities. There's often a tendency to downplay pain or avoid seeking help, especially in busy environments where stopping feels inconvenient or unnecessary. This mindset can turn a warning sign into a life-threatening situation simply because it wasn't taken seriously in time. Technology and awareness have improved over the years, but the gap between knowledge and action still exists. About heart attack symptoms before, but when the moment comes, uncertainty takes over. They question whether it's serious enough to act on, whether they're overreacting, or whether they should wait a little longer. That hesitation is where the real danger lies because heart attacks don't wait for certainty. They progress silently, steadily, and sometimes irreversibly while a person is still trying to decide what's happening in your body. Rarely goes from perfectly fine to a full-blown heart attack without warning. In many cases, it starts by whispering subtle, quiet signals that something is right. The problem is these early warning signs don't feel urgent or dramatic. They blend into everyday life so easily that most people overlook them completely. A slight discomfort in the chest might feel like gas or acidity. A wave of fatigue could be blamed on poor sleep. Shortness of breath might seem like you're just out of shape or stress. These small signs are often your body's first attempt to alert you that the heart is under stress. One of the most common early signals is chest discomfort, but it's not always painful. It can feel like pressure, tightness, fullness, or even a mild squeezing sensation. It may come and go, lasting a few minutes before disappearing, only to return later. Because it's not severe, people often dismiss it, that this could be the beginning of reduced blood flow to the heart, and not realizing that this could be the beginning of reduced blood flow to the heart. Another early sign is unusual fatigue, feeling extremely tired without any clear reason. Normal tiredness after a long day, it's a deeper, heavier exhaustion that doesn't improve with rest. Many people, especially women, report this symptom days before a heart attack occurs. And you might notice that simple activities like walking, climbing stairs, or even talking leave you feeling slightly breathless. It may not feel severe enough to raise alarm, but it indicates that your heart is struggling to pump efficiently. Sometimes this symptom appears even when you're at rest, making it even more confusing and easy to misinterpret. Alongside this, there can be sensations like lightheadedness, dizziness, or a sudden feeling of weakness, as if your body is momentarily losing balance or energy. Nausea and discomfort in the upper body are also common early signs. People often mistake these for digestive issues. A feeling of indigestion, bloating, or mild stomach pain can actually be related to heart. Similarly, discomfort may spread to areas like the shoulders, arms, neck, jaw, or back. These sensations are usually not sharp or intense. Instead, they feel dull and vague, which makes them easy to ignore or attribute to muscle strain or poor posture. The body doesn't always send clear, loud alarms, often communicates in these quiet, indirect ways. What makes these early warning signs dangerous is their inconsistency. It can appear briefly, disappear, and then return later. This pattern tricks people into thinking the problem has resolved on its own. In reality, the underlying issue may still be developing. The heart might be receiving less oxygen than it needs, and the situation can escalate without much notice. And ultimately, recognizing these whispers requires awareness and trust in your instincts. If something feels unusual or out of the ordinary, especially when multiple symptoms appear together, it's not something to brush aside. Body's attempt to protect you before the situation becomes critical when most people think of a heart attack. They picture a very specific scene: intense chest pain, a person clutching their left arm, collapsing suddenly. That image is based on what we call classic symptoms, and while those do occur, they are only part of the story. The reality is far more complex because heart attacks don't follow a single pattern. There are classic symptoms, and then there are atypical ones, the quieter, obvious signals that can easily be mistaken for something else. Understanding the difference between these two is critical because many people who experience atypical symptoms don't realize what's happening until it becomes severe. Classic symptoms are the ones most widely recognized. These include a strong pressure, tightness, or squeezing pain in the center of the chest that may last for several minutes or come and go. The discomfort can spread to the left arm, shoulder, or even both arms. Might be accompanied by sweating, shortness of breath, or a feeling of heaviness that makes it hard to move. These signs are more commonly reported in men, which is why they've become the standard image of a heart attack. Because they are more dramatic and recognizable, people are more likely to respond quickly when they experience them. Atypical symptoms, however, are where things become dangerous. These symptoms don't match the expected pattern, which makes them easy to overlook. Instead of intense chest pain, a person might feel mild discomfort or no chest pain at all. The pain might appear in unexpected areas like the jaw, neck, back, or even the stomach. It can feel like a dull ache, a burning sensation, or something similar to indigestion. There may be nausea, lightheadedness, or an overwhelming sense of fatigue that doesn't seem connected to physical exertion. These symptoms are subtle, scattered, and often confusing. Women are particularly more likely to experience atypical symptoms instead of the classic crushing chest pain. Many women report shortness of breath, unusual tiredness, nausea, or discomfort in the upper body. This difference in symptom presentation is one of the reasons heart attacks in women are more frequently misdiagnosed or diagnosed later than in men. Younger individuals can also experience atypical signs, which further complicates recognition because heart attacks are often associated with older age. Symptoms is delay. Because they don't seem severe or heart-related, people tend to wait, hoping the symptoms will pass. They might take antacids for what they think is acidity, rest for what they assume is fatigue, or ignore discomfort believing it's temporary. This delay allows the heart to continue suffering damage while the person remains uncertain about what's happening. Time is critical during a heart attack, and every minute of hesitation increases the risk of long-term damage or death. What makes this even more challenging is that atypical symptoms can appear gradually rather than suddenly. They might build over hours or even days, creating a false sense of security. A person might feel slightly off, but not enough to seek help immediately. This slow progression masks the seriousness of the situation, making it harder to connect the symptoms to a heart-related issue. Recognizing that heart attacks don't always look dramatic is one of the most important steps. Improving survival because awareness of both classic and atypical signs allows people to act faster. Even when the symptoms don't fit the expected pattern inside your chest, your heart is working every second like a powerful, tireless pump, pushing oxygen-rich blood through a network of vessels that keep every organ alive. To understand what happens during a heart attack, imagine this system as a series of smooth, flexible pipelines called coronary arteries. These arteries are responsible for delivering oxygen and nutrients directly to the heart muscle itself. Under normal conditions, blood flows freely through them, allowing the heart to beat efficiently without interruption. But over time, these arteries can begin to narrow due to the buildup of fatty deposits known as plaque. This process happens slowly and silently, often without any noticeable symptoms, gradually reducing the space through which blood can travel. Now picture this as a 3D animation. The inner walls of an artery, once wide and clear, slowly becoming coated with layers of plaque. The passage narrows and blood flow becomes restricted. Most of the time, the body adapts to this reduced flow, which is why a person may not feel anything unusual at first. However, the real danger begins when one of these plaques becomes unstable. If it ruptures, the body reacts immediately by forming a blood clot at that site, as if trying to repair an injury. completely. At the moment the artery becomes blocked, blood can no longer reach a portion of the heart muscle. This is the critical point where a heart attack begins. Without oxygen, the affected heart tissue starts to suffer damage within minutes. Cells begin to weaken and die, and the longer the blockage remains, the more extensive the damaged muscle. Every second that passes without restoring blood flow leads to irreversible loss of function. As this process unfolds, the heart struggles to maintain its normal rhythm and pumping ability. Electrical signals that control the heartbeat can become unstable, sometimes leading to dangerous arrhythmias. This is why some heart attacks can cause sudden cardiac arrest, where the heart stops beating effectively. At the same time, the body responds to the lack of oxygen with a cascade of signals: pain, pressure, shortness of breath, trying to alert the person that something is wrong. What's important to understand is that this entire sequence can happen rapidly. In some cases, the blockage forms within seconds, turning a partially narrowed artery into a completely closed one almost instantly. In others, it may develop more gradually, with symptoms appearing and disappearing as blood flow fluctuates. Regardless of the speed, the underlying mechanism remains the same: a blocked artery depriving the heart of oxygen. Modern treatments focus on reopening that artery as quickly as possible, either with medications that dissolve clots or procedures that physically restore blood flow. But none of that can happen unless the person recognizes the symptoms and seeks help in time. The heart itself cannot repair severe damage once cells have died, which is why early action is so critical. Understanding what happens inside the heart transforms the event from something mysterious into something clear and urgent. A chain reaction that starts with a blockage, if not stopped quickly, leads to permanent injury within the very organ that keeps everything else alive. When a heart attack begins, the most critical factor is not strength, luck, or even age, it's time. There is a narrow window, often referred to as the golden minutes, where the actions you take can dramatically change the outcome. This is the period when the heart muscle is still salvageable, when damage can be minimized, and when survival chances are at their highest. But this window doesn't stay open for long, and what makes it dangerous is that it often closes while people are still hesitating, still unsure, still hoping the symptoms will go away on their own. The first and most important step is recognizing that something is wrong and acting immediately. The moment you suspect a heart attack, you should call emergency services without delay. Not after waiting 10 minutes, not after trying home remedies, not after asking others for reassurance. Lives. Emergency responders are trained to begin treatment on the way to the hospital, which means help starts the moment they arrive, not after you reach a medical facility. Many people make the mistake of trying to drive themselves or asking a family member to drive them, but this can be risky. A heart attack can worsen suddenly, and losing consciousness while driving can turn a medical emergency into a fatal accident. Sit down, stay as calm as possible, and avoid any physical exertion. Panic can increase the heart's demand for oxygen, which is exactly what the heart is already struggling to receive. Controlled breathing and stillness can help stabilize the situation while you wait for medical support. If aspirin is available and there is no allergy or medical restriction, chewing a standard dose can help thin the blood and slow the growth of the clot that is blocking the artery. This simple step has shown to improve outcomes when taken early, but it should never replace calling for help. It is only a supportive measure, not a solution. Another critical aspect of these golden minutes is not ignoring or downplaying the symptoms. People often second guess themselves, worrying about overreacting or causing unnecessary concern. This hesitation is one of the biggest dangers. It is always better to act and be wrong than to wait and be right too late. Medical professionals would rather evaluate false alarm than deal with the consequences of delayed treatment. The cost of hesitation is measured in heart muscle damage, and once that damage occurs, it cannot be reversed. If someone else is experiencing a heart attack, your role becomes just as important. Call emergency services immediately, help them sit or lie down comfortably, and stay with them. Can keep blood flowing to vital organs until professional help arrives. Every action during these moments contributes to survival, and even small decisions can have a significant impact. What makes the golden minutes so powerful is that they represent a turning point. Before this moment, the heart is under attack but still recoverable. After it passes, the damage becomes permanent, affecting not just survival but the quality of life afterward. Quick action can mean the difference between a full recovery and long-term complications. It transforms a potentially fatal event into a manageable medical condition, but only if those minutes are used wisely, decisively, and without hesitation. Prevention is not something that happens in a single moment. It's built quietly, day by day, through the choices you repeat when no one is watching. A heart attack may feel sudden, but in most cases, the conditions that lead to it develop over years. That means you have far more control than you might think. The habits you follow every morning, the food you choose, the way you manage stress, your level of activity, all of these shape the health of your heart long before any symptoms appear. Prevention is your daily armor, and the stronger you build it, the lower your risk becomes. Diet, what you eat directly affects your blood vessels, cholesterol levels, and overall heart function. Diets high in processed foods, unhealthy fats, excess sugar, and salt can gradually damage the arteries, encouraging plaque buildup and narrowing blood flow. On the other hand, a diet rich in fruits, vegetables, whole grains, healthy fats, and lean proteins supports cleaner, more flexible arteries. It's not about perfection, it's about consistency. Small, healthier choices repeated over time create a protective effect that strengthens your cardiovascular system. Physical activity is another essential pillar of prevention. The heart is a muscle, and like any muscle, it becomes stronger and more efficient when used regularly. Exercise improves blood circulation, helps maintain a healthy weight, lowers blood pressure, and reduces stress, all of which contribute to a healthier heart. This doesn't require extreme workouts or hours in the gym. Even moderate activities like walking, cycling, or light exercise done consistently can make a significant difference. The key is movement, avoiding long periods of inactivity, and keeping your body engaged. Health. Chronic stress can lead to increased blood pressure, unhealthy coping habits, and hormonal changes that strain the heart over time. In today's fast-paced world, stress becomes a constant background noise, something people learn to live with rather than manage. Learning how to pause, breathe, and reset your mind is just as important as diet and exercise. Whether it's through relaxation techniques, mindfulness, or simply taking time to rest, managing stress reduces the hidden placed on your heart. Avoiding harmful habits is equally important. Smoking, for example, is one of the most damaging factors for heart health. It directly affects blood vessels, reduces oxygen levels, and accelerates the buildup of plaque. Similarly, excessive alcohol consumption can raise blood pressure and contribute to heart-related problems. Eliminating or reducing these risks significantly improves your long-term heart health and lowers the chances of a future heart attack. Regular health. Monitoring adds another layer of protection. Conditions like high blood pressure, high cholesterol, and diabetes often develop silently without obvious symptoms, yet they significantly increase the risk of heart disease. Routine checkups and simple tests can detect these issues early, allowing you to manage them before they cause serious damage. Awareness gives you the opportunity to act early rather than react later. Prevention is not about fear, it's about control. That your daily decisions are shaping your future health in ways you may not immediately see. Each healthy choice strengthens your defenses, while each neglected habit weakens them. Over time, these choices add up, either building resilience or increasing risk. The power lies in consistency, in the small actions you take repeatedly, because those actions determine whether your heart remains strong and protect is not just medical emergency, it's a test of awareness, timing, and action. Your body does not fail without warning. It signals, it whispers, it tries to alert you long before the situation becomes critical. The real danger is not just the condition itself, but the hesitation, the doubt, and the misinterpretation that delay life-saving decisions. When you understand the signs, when you recognize that symptoms don't always look dramatic, and when you respond without waiting for certainty, you take control a moment that could otherwise control you. Every second matters, but every day matters too. The choices you make daily, how you eat, how you move, how you manage stress, and how seriously you take your health are shaping your heart's future long before any emergency begins. Prevention builds strength, awareness creates readiness, and quick action saves lives. So remember this. Don't wait for pain to become unbearable. Don't wait for confirmation, and don't wait for a second chance. Listen to your body. Trust what it tells you and act when it matters most, because in the story of a heart attack, the ending is often decided in the moments when you choose not to ignore the